Hello students, welcome to today's lesson. We will be looking at common sports injuries and first aid. First, we'll be able to define injuries, sports injuries. We'll know the causes of sports injuries. We'll see examples of common sports injuries, then treatment of the common sports injuries in this lesson. First, what is an injury? An injury is a damage to any part of the body that may allow the escape of blood as a result of accident. The injury can affect the leg, the head, the hand, the shoulder, any parts of the body. What are sports injuries? Sports injuries are injuries that occur during participation in sports and games due to accidents. These injuries can be caused by poor lighting, carelessness, negligence, lack of proper knowledge of the game, irregular or poor exercise before the game, and the rest of them. I want to look at examples of common sports include dislocation, sprains, strain, fracture, wound, drowning, muscle cramp, bleeding, cuts. When injury occurs, there is need first aid. Therefore, we say a first aid is immediate and first treatment given to an injured person before the arrival of a medical personnel. The first aid is given by a qualified first aider who uses the knowledge of first aid and the first aid box. The first aid box contains everything the first aider needs. The first common sports injury we will be looking at is strain. And strain is an injury to the muscle or the tendon. The tendon is a white tissue that connects the muscle to the bone. The second is strain. When you look closely, you will see a white tissue connecting two bones. The white tissue connecting these two bones is the ligament. A strain affects the ligament. Strain is an injury to the ligament as a result of overstretching. The next one is dislocation. Dislocation is a displacement of one or more bones at a joint. Now, when a bone end leaves its position, it results in dislocation. As you can see, this is the right is the normal leg, while the left is the dislocated one. The bone has shifted to the left side, and the ankle rather is swollen. The next is fracture. Fracture is a break in the continue of a bone in the body. The fracture can be compound or open fracture, where the bone is seen on the surface of the skin. It can also be closed, where the bone is broken but the skin covers it. It can be incomplete or green fracture, where the bone is slightly broken. It can be total or complete fracture. The bone is broken into two parts. Displaced fracture, where one bone is broken, usually affects the lower leg and the lower arm. The next is the comminuted fracture, where the bone is broken into pieces. Mostly surgery is done for this comminuted fracture to ensure recovery. Another type of fracture is the depressed fracture, which affects the skull. We'll move on to treatment of common sports injuries. How do we treat these common sports injuries? The first aid treatment is what we are going to consider. Firstly, strain and sprain.
In this tutorial, we're going to look at the treatment for strains and sprains. Our treatment for a strain or sprain is, we use the acronym RICE. You rest the injured limb, you place ice on it, you put a compression bandage on it, and you elevate it. Our casualty here, I'm going to expose the injured limb. I'm going to use my kit bag here, and I'm going to elevate the limb. Next thing, I want to put some ice on it. So when we use an ice pack, we never put it directly on the skin, we always use a bandage. Here I have my instant ice pack. I'm going to break, distribute the contents evenly. Now I'm going to wrap it up. And now I'm going to place this over the injury. I'm going to leave this here for 10 minutes to cool down the injury and also help reduce swelling. After the 10 minutes, next I'm going to use a compression bandage to put compression or apply pressure over the injury. They come with a clip. We're going to discard the clip and we'll use tape to secure it. So you start above the joint, secure your bandage, you come down and we're going to do a figure of 8 around the injury and back up, and we're going to keep doing this. We're going to use the whole of the bandage and keep it good and tight. So continue doing our figure of 8. As you will notice as we're doing it, the heel is going to remain exposed, but we're keeping good pressure on the injury to keep the pressure on the joint. So once you come to the end of your bandage, again you're going to use the whole of the bandage. I'm going to secure it here around the ankle. Again, open it fully, and again I'm going to use 2 pieces of tape to secure the bandage in place. And our last part of the treatment, we need to keep the leg elevated, and as you can see, it's elevated here.
First aid of broken bones. Fracture. A fracture is a broken bone. It requires medical attention. If the broken bone is the result of major trauma or injury, call your local emergency number. What are the symptoms of a broken bone? Number first, intense pain in the injured area that gets worse when you move it. Number second, numbness in the injured area. Number third, bluish discoloration, swelling or visible deformity in the injured area. Number 4, bone protruding to the skin. Number 5, heavy bleeding at the injury site. Don't move the person except if necessary to avoid further injury. Take these actions immediately while waiting for medical help. Stop the bleed. Elevate and apply pressure to the wound using a sterile bandage, clean cloth or a clean piece of clothing. Immobilize the injured area. If you suspect broken a bone in their neck or back, help them stay as still as possible. If you suspect they have broken a bone in one of their limbs, immobilize the area using a sling or sling. Apply ice packs to limit swelling and help relieve pain. Don't apply ice directly to the skin. Wrap the ice in a towel, piece of cloth or some other material. Treat for shock. If the person feels faint or is breathing in short, rapid breaths, lay the person down with the head slightly lower than the trunk, and if possible, elevate the legs. Call for emergency help if The person is unresponsive, is not breathing, or is not moving. Begin CPR.
Hello! In this health sketch, we want to talk to you about CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the centre of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimetres. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it. So to recap, remember doctor's ABC. And if you have it, D. That's D for danger, R for response, S, shout for help, A for airway, B for breathing, C for circulation, and D for defibrillation. In this health sketch, we've shown you the simple steps you can take to help someone who has collapsed, is not breathing, or not breathing normally. Why not take a training course to practice these steps? Share this video with friends and family to make sure we all know what to do. Health sketch. Health for all to see.